In one of my previous videos, I talked about preterm labor and the fact that it's a possible occurrence in some pregnancies, and I advised pregnant women to be aware of it and be ready for any eventualities. I got a ton of questions about it, asking for clarity. I personally experienced preterm labor and birth, and that is why I'm making this video to explain preterm labor in the best and simplest way that I can, so that you can understand it very well and take care of yourself. So grab your popcorn and let's dive in. So this video will cover the detailed explanation of what preterm labor is, popularly known as premature labor, and why it happens, the risk factors or the causes of preterm labor, the signs and symptoms, what to do, and the possible health complications of a preterm birth on both the mother and the baby. So make sure you watch this entire video so that you don't miss any important points. In normal pregnancies, a full-term delivery occurs at around 40 weeks, allowing the baby sufficient time to develop and mature in the womb. However, when labor begins too early, before the baby is fully developed and before the 40 weeks or at least 37 weeks, it is considered preterm labor, and such babies when born are termed preterm babies. So typically, preterm labor or premature labor refers to the onset of labor before 37 weeks of gestation, leading to premature birth. During pregnancy, the cervix remains closed and firm, helping to keep the baby securely inside the uterus. As the due date approaches, the cervix gradually softens, shortens, and starts to dilate in preparation for labor. However, in preterm labor, the cervix undergoes these changes too early, indicating that the body is attempting to deliver the baby prematurely. Preterm labor is a serious concern because babies born prematurely may face a range of health complications. The earlier a baby is born, the higher the risk of complications such as respiratory distress syndrome, immature lungs, difficulty regulating body temperature, feeding difficulties, jaundice, and an increased susceptibility to infections. Preterm babies may also experience long-term developmental issues, including cognitive and motor delays. Did you have a preterm birth? Let me know in the comment section. The exact causes of preterm labor are not always known, but several risk factors have been identified, and one of such is previous preterm birth. Women who have previously given birth prematurely are at a higher risk of experiencing preterm labor in subsequent pregnancies. And secondly, there is multiple pregnancies. That is, women carrying twins, triplets, or more are more likely to go into preterm labor. The risk is primarily associated with the increased strain on the uterus and cervix due to the presence of multiple fetus. Number 3, chronic conditions. Women with certain conditions like high blood pressure, preeclampsia, gestational diabetes, kidney disease, autoimmune disorders, and so on are more likely to undergo preterm labor. Now, number 4, we have the uterine or cervical abnormalities, which can contribute to preterm labor. A short cervix, which is less able to support the growing fetus, or an incompetent cervix which dilates prematurely without contractions are common abnormalities associated with preterm labor. Number 5 is placenta problems. Placenta problems. Complications related to the placenta can trigger preterm labor. This may include placenta abrupture or placenta previa. Abrupture placenta is where the placenta partially or completely separates from the uterus before delivery, and placenta previa is where the placenta covers the cervix and can lead to preterm labor. In my own case, it was placenta abrupture, by the way. Now, other risk factors include infections, maternal lifestyles like drugs, smoking, excessive alcohol consumption, poor nutrition, stress, etc. Short interpregnancy interval of less than 6 months, or maternal age of less than 17 years and more than 35 years. Now, it is important to note that having one or more risk factors does not guarantee preterm labor will occur. Conversely, some women may experience preterm labor without any identifiable risk factors. Each pregnancy is unique, and healthcare providers assess individual circumstances to determine the appropriate care and monitoring needed to mitigate the risk associated with preterm labor. Now, go and watch this next video here on the signs and symptoms of preterm labor, what to do when you experience these symptoms, treatments or management of preterm labor, how to handle preterm babies, and the possible health complications of premature birth for both the mother and the baby. See you.